In this video, we are going to be looking at the topic polysomnography. This is part 1 video where we'll be addressing the definition, the staging of sleep, the objectives of polysomnography, the parameters that are recorded in polysomnography, additional measures that are used in advanced polysomnography, and its types. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. Sleep is essential for physiological restoration, learning, memory, and immune function. Sleep disorders are increasingly recognized as global health concerns. Polysomnography, PSG, remains the gold standard for diagnosing sleep disorders. This combines multiple physiological monitoring systems in one test. Polysomnography is defined as a comprehensive overnight diagnostic test that records biophysiological parameters during sleep to assess sleep stages and identify sleep abnormalities. This is derived from the term poly, which means many, somno, which refers to sleep, and graphy, recording. For understanding why a polysomnography has to be done, one has to understand the stages of sleep. The first is NREM sleep stage 1, that is non-rapid eye movement. Here, it is the lightest sleep of short duration, the muscles relax and the eye movements are slow. It is easy for the person to wake up and the person is unaware of the sleep. The next is NREM sleep stage 2. This is about 50% of the total sleep. The body cools and the heart rate slows. Here, the sleep spindles and K complexes appear. The next is NREM sleep stage 3. This is a deeper sleep and it is a slow wave. During this stage, physical recovery and growth hormone release happens. In this stage, the person is hard to wake up and the person feels groggy if awakened. The last stage is REM sleep, that is rapid eye movement sleep. This is a dreaming stage where the brain is active. This facilitates emotional stability, learning, and memory, and the body is paralyzed, which is otherwise termed as atonia. The normal sleep cycle repeats 4 to 6 times per night. Let's look at the objectives of doing a polysomnography. It is to analyze sleep architecture and sleep efficiency, to detect sleep disordered breathing, that is obstructive sleep apnea, which is a common sleep disorder where the upper airway repeatedly collapses during sleep, causing pauses in breathing, that is apnea, or reduced airflow, that is hypopnea. And central sleep apnea. This is a disorder where the brain fails to signal the breathing muscles, causing pauses in breathing during sleep, unlike obstructive sleep apnea where the airway itself is blocked. PSG can also be used to identify movement disorders. Example is periodic limb movement disorder, which involves involuntary repetitive jerking or twitching of limbs, typically legs, every 20 to 40 seconds during sleep, causing poor sleep, daytime sleepiness, and often noted by bed partners. PSG can also be used to diagnose parasomnias, which involves unusual behaviors like sleepwalking, talking, or acting out dreams during sleep transitions or deep sleep, including actions like night terrors, sleepwalking, sleep paralysis, and vivid nightmares, often with little memory of the event when the person wakes up. PSG can also be used to evaluate cardiac rhythm changes during sleep and to assist in titration of CPAP or BiPAP therapy. Let's look at the parameters that are recorded in polysomnography. Based on the system, we will see the tool used and the function. The first is the central nervous system and the tool used is electroencephalography. It is a safe, non-invasive test that records a brain's electrical activity using electrodes placed on the scalp, producing wavy lines that look like brain waves, which are used primarily to diagnose epilepsy and seizure disorders, but also sleep problems or brain injury effects. So in this, the function is to see the staging of sleep through brain activity. The next is to see the ocular movement, and the tool used is electrooculography, which is a technique using electrodes around the eyes to measure the electrical potential difference, otherwise referred to as corneoretinal standing potential between the cornea and the retina. This helps in detecting eye movements, blinks, and assessing retinal health. So in PSG, this is used in detecting rapid eye movement sleep. The next is to assess muscle activity, and the tool used is EMG. Electromyography measures muscle response or electrical activity in response to a nerve's stimulation of the muscle. This test is used to help detect neuromuscular abnormalities. So here we specifically see for atonia and any movements. The next one is to see the cardiac function, and the test used is ECG, which is electrocardiogram. This is a quick painless test that records a heart's electrical activity, showing its rate and rhythm by detecting electrical signals from electrodes placed on the skin, help diagnose heart attacks, arrhythmias, and other conditions by revealing the pattern of heartbeats. So here in PSG, this helps in detecting arrhythmias. Next, for respiration, the tool used is nasal airflow and the thoracoabdominal movements to detect apnea. For oxygenation, a pulse oximeter is used, which measures the oxygen saturation, and this is to see if the patient is going into hypoxemia. The next is snoring, which using a microphone, the snoring can be detected. For body position, positional sensors are kept to assess positional apnea, and for behavior, the audio and video serves as a tool, and it is helping in diagnosing parasomnias. Let's look at the addition measurements that are used in advanced polysomnography. Esophageal manometry uses a catheter to measure esophageal pressure, providing precise respiratory effort data to diagnose sleep disordered breathing, especially upper airway resistance syndrome, and differentiating central versus obstructive events. End-tidal carbon dioxide monitoring in polysomnography non-invasively measures exhaled carbon dioxide to assess ventilation, especially for sleep disordered breathing like sleep apnea, detecting hypoventilation and airway obstruction by showing carbon dioxide buildup or poor gas exchange, providing continuous data often through nasal prongs to complement the standard polysomnography. This helps in diagnosing pediatric hypoventilation and correlates well with apnea or hypopneic index AHI, offering insights into disease severity, post-apnea recovery, and overall ventilation status. Electromyography of tibialis can be done for periodic limb movement disorder. Next is actigraphy adjunct for sleep-wake cycles. This is a wrist-worn movement tracker providing long-term naturalistic sleep data at home, estimating sleep-wake cycles from limb movement, while polysomnography is a gold standard lamp-based test. Let's look at the types of polysomnography. The first one is diagnostic PSG, which is for baseline sleep evaluation. The next is split night PSG, which is for diagnosis in the first half and CPAP titration in the second. The third one is CPAP BiPAP titration study, which is done to optimize the pressures. The fourth one is multiple sleep latency test, which evaluates daytime sleepiness, that is narcolepsy. And the fifth one is maintenance of wakefulness test to assess wakefulness. The following are the references. Do look out for the next part of this video. Thank you for watching.